Hey everybody, Dr. Healy from Root Healing Wellness here. Here we're going to talk about more menstrual irregularities today, specifically cysts, fibroids, and endometriosis. So polycystic ovarian syndrome really has two main mechanisms. You have the hormonal imbalances and the blood sugar regulation issue. So oftentimes standard of care is really going to look at things like birth control or diabetes medication, for example, metformin, even if you're not a diabetic. So even with those treatments, there's nothing done to actually shrink the cyst. Okay, we want to keep this in mind. Also with uterine fibroids, no care. They can give you hormone replacement therapy. They try to have the fibroids not grow more or get new fibroids, but nothing shrinks the fibroids. And then there's endometriosis. So endometriosis also, sometimes hormones are used, but as far as endometrial tissue, they have really one option, and that is surgery. So surgery becomes the main option for things like cysts, fibroids, and endometriosis. So what I'm trying to tell you today is all three of those are treatable in many cases and non-surgically. So there are treatments that can be done. For example, if you're looking at PCOS, polycystic ovarian syndrome, then you have the blood sugar regulation issue. So that needs to be regulated. That's mostly a gut and liver imbalance problem that can often be regulated through things like detox, dietary changes. And then the cysts can be shrunk through things like Chinese herbs. Uterine fibroids, you have to think about things like herbs that balance the hormones, but also we can shrink the fibroids with cysts, herbs. So when we're looking at the timetable, how long does it take to shrink masses? Well, that varies. How big are the masses? How many are there? But oftentimes we look at about 2 to 3 months where you can do things like get a scan before, you can take products, you can get a scan after, you can see how much of the cysts or fibroids were shrunk. In the case of endometriosis and endometrial tissue, you're really looking at complicated surgeries where the endometrial tissue will often grow back anyway. So when you do things like herbs to kind of help shrink endometrial tissue, what you'll see, oftentimes the first sign is people with endometriosis, they have very painful, irregular periods with lots of clotting. And what often is the first sign that happens sooner as opposed to later, it doesn't take months and months and months, is you'll start to see the clotting becoming less, which is a good sign that you're starting to clean up the endometrial tissue. So all of these conditions, PCOS, with cysts, fibroids, endometriosis, all solvable in many cases through non-surgical and non-hormonal treatments. So if these conditions are things that bother you, your friends, or your loved ones, go ahead and reach out to us, and what we'll do is we'll have a consultation and see if it's appropriate for them to receive care from us. I hope you learned something today. Thank you very much.